Almost ready. All right, looks like we are ready and live streaming. So I want to welcome you on this cold afternoon. Welcome to our Lunch and Learn with Dr. Alexander Watson. Dr. Watson had completed his residency training in physical medicine and rehabilitation at the University of Pittsburgh Medical Center and provided prehabilitation counseling. He's going to tell us more about that today for patients prior to solid organ transplant, spine surgery, bariatric surgery, and cancer treatments, and published multiple book chapters and articles on back pain, obesity medicine, and the continuum of care during cancer rehabilitation. That was a mouthful. Currently, he provides both rehabilitation and inpatient rehabilitation services through his multidisciplinary medical practice called Admire Medical. In his most important role, Dr. Watson continually refines his sense of humor as a devoted husband and father. So we welcome you and thank you for sharing with us today.
Thanks for having me, Erica. So first, Alex is fine. We don't need to do Dr. Watson kind of stuff here. And then also, whenever that kind of segment is read, I think back to my dad joking, solid organ transplant. What kind of other organs can be transplanted? So, little dad humor here and there might pop up in this presentation too. So bear with me on that kind of stuff. But basically, just to kind of recap, we at Admire Medical here do a lot of counseling for folks in kind of a general weight loss and preventative medicine area of things. But my initial passion was in prehabilitation. Prehabilitation is the idea that, walking around, we're not all in our best state of health. And then if there's a new diagnosis, whether it be, need a hip transplant, hip replacement there, or knee replacement, or bariatric surgery, or cancer therapies, or something like that, a little effort ahead of time can go a long way in terms of outcomes. So, less fewer complications or faster recovery, and better outcomes in general in terms of response to therapies. So all the concepts here will touch on rehabilitation, but they're 100% applicable to everyone's daily life. Eric and I were just talking about that. My sister and I are training for a competition that's kind of like a CrossFit type thing. And we're using all these principles as a point of showing just how much better it can make you feel and how quickly you can improve your health when you do everything together. So there's obviously a lot of synergy between, the right exercise moves with the right nutritional kind of changes, a few different stress management techniques, and all of a sudden, what used to take months to happen happens in a month or two or a few weeks and that kind of thing. So the big takeaway from the practice is there are a few strategic moves you can make for fast improvements in your health, and then use that momentum to keep you going and really just kind of feel well for a long time. But generally, how can we get more for less? That's going to be the takeaway here. And if I talk really fast, it's because we had a training session this morning for that competition, and it took an abundance of caffeine to get me going. So please raise a hand, unmute, tell me to slow down if I do get a little too Jersey in here, okay?
And I'll just butt in and say, I forgot to say, you can put questions in the chat as well if you want me to interrupt instead of you yourself. And I'll be happy to ask questions for clarification. And we will have time for questions at the end as well.
Yes, that's an important point too. Questions in the middle is okay, especially if there's something on the slide here that you need a little more explanation about, not a problem, or at the end is going to be available time for questions too. So everything in rehabilitation, I try and break it down to pillars. In this case, the main pillars for today, and they kind of morph a little bit here and there, but for today, it's going to be your exercise, nutrition, hormones, and general mindfulness, and kind of stress reduction techniques. When it comes to exercise and the different kinds of exercise, done right, it's not that bad. If you're not a big exercise person, there are ways to get the most out of only a few sessions a week, or ways to even kind of change what you're already doing and just make it that much more effective. We'll dive into all each of these a little later in more depth, but I want to introduce kind of where that theme is going to be when we get there. Nutritionally, my favorite thing to say is that almost anything is on the table here, in terms of favorite foods and that kind of stuff, or areas you won't go in terms of foods. I'm not going to make you eat broccoli kind of thing, but moderation may be necessary, of course, for certain things. Whereas other ones, I'm going to tell you to eat far more than may, you might have thought you're able to, kind of thing, or is healthy to do so. So we'll get into that as well. Hormones, really broad topic. I could do that one for 2 hours, but we'll kind of do a quick run through when we get there in terms of just the main, male hormone replacement therapies, testosterone, that kind of thing, and then a little bit of HRT on the women's side as well. In this practice, I do most of the testosterone replacement, and then Angela, our nurse practitioner, does the hormone replacement therapy for menopause and those kinds of transitions. So I will have a little more on the input on the male side, but we'll absolutely get into some detail on the HRT side as well for menopausal therapies. And then finally, mindfulness. Not a secret that mental health kind of took a dive a little bit during COVID and still on the way up. The further rise of social media and new apps, and hence why TikTok was almost banned, that and the national security threat and all that stuff. But there's everything in moderation again, right? So exercise. So in this case, broadly, there's two, of course: resistance training and aerobic training. You can always have different kind of combinations of the two, or if you're thinking about high intensity interval training kind of thing, that's going to be a little bit of both. But broadly, resistance training is going to focus on one type of muscle fiber that strengthens the muscle, lifts heavy weight. You can only do it for a little bit of time. Those muscle fibers run more on glycogen, which is a starch of glucose for energy. And that's where a lot of it's stored. That's an important point for later. Aerobic training is going to be anything you can sustain for longer period of time. Heart rate typically is going to be in the 120s to 160s, 170s range, less intense than resistance training. Often, of course, there are exceptions here, but for our intents and purposes, really, aerobic training can be as simple as just walking enough in the daytime. But if you add a little bit more intensity there, you can get more out of that in terms of just general energy levels, the cardiovascular health benefits, and the weight management effect of each of these is a little bit different. I don't want to steal from the next slide. So getting here, first off, I want to point out before it gets distracting that AI decided that the optimal barbell placement is through the person's jaw. I don't recommend that as a physician. It's not a great place to hold the barbell, but I want to get that off the radar to start. But with resistance training, you're building muscle mass, and muscle mass is not just a vanity thing. It's the primary place that we store blood sugar. So if you have any sort of blood sugar issues, building more muscle ends up being a place to store more blood sugar, and it can help reverse insulin resistance and diabetes. It's a big takeaway that even in med school, most people think that it's going to be in the liver because that's a very primary place for it all, and that's where a lot of the glucose management happens. But really, your biggest reservoir for storing sugar is your muscles. So more muscle, easier time finding a place to put that stuff. We all know that you have more muscle, you're going to burn more calories just doing all the normal daily things. That's for a couple of reasons. One of which is, of course, it takes a lot of energy to keep muscle there, which is why evolutionarily our bodies are programmed to try and shed as much muscle as we don't need. But also, there is a impact on thyroid hormones with that resistance training and extra muscle mass. So you get kind of a dual benefit there in terms of the metabolic effect. When it comes to weight loss, muscle mass, the main benefit is going to be preventing the weight regain, because one of the ways that our bodies compensate for weight loss is to throttle down that thyroid hormone and find ways to stimulate appetite and all those things. So if you're carrying this muscle mass, not only are you going to have that metabolic rate staying higher, but you're also going to maintain all the healthful benefits. And so you get far more fat burning from the weight loss medications like the Wegovys and the Zepbounds of the world. So you have less of a weight regain afterwards if you try and wean off of that. Again, a topic I could talk about for hours. We're going to try and condense it down to something more palatable today. The insulin sensitivity, again, besides the place to store glucose, in the longer term, the anti-inflammatory effects of resistance training and the extra muscle mass can also help maintain insulin sensitivity. And part of the reason why our muscles and our bodies become insulin resistant is the storage of kinds of fat in muscle cells. By doing that, they become less able to respond to insulin to bring sugar in there. So exercise is going to burn off that fat. In those cases, it may be more on the aerobic side than the resistance training side. However, more muscle means more places to store everything, and so less insulin resistance for that reason as well. We already touched on the maintenance of lean mass in terms of weight loss. So again, resistance training, big takeaway. It'll help you lose weight a little bit, but really it's more of a weight maintenance afterwards. So once you lose weight, helps prevent that regain. On top of that, of course, there's bone density benefits. And, really the biggest thing that resistance training, besides all this stuff that can do, is for decades, we always thought that after your 30s or late 20s, you couldn't put on bone density. We have recent studies to say the exact opposite. Actually, as long as you're lifting quite heavy, and even if you have osteoporosis and osteopenia, you can actually rebuild bone density. And a lot of that is going to be needed with a high protein diet as well. That, of course, is one thing you really want to make sure that you do under supervision of a trainer, a physical therapist, a doctor, all the above, because if you already have bone density issues, lifting heavy, of course, is where you're putting the most stress on those things. So you want to do it safely and, under supervision and everything like that. Any questions so far? Excellent. All righty. Aerobic training. We all know a lot of the benefits here, of course. It's going to improve cardiovascular function. It's going to have, resistance training, strength training can actually raise blood pressure a little bit, whereas aerobic training undeniably lowers blood pressure. It improves the ability of the heart to move blood around with fewer contractions. So while you, during exercise, will raise your heart rate, the rest of the time, heart rate comes down. And that is associated with, of course, longer-term heart benefits. It seems to be that aerobic training in particular has more of an impact on raising that HDL cholesterol, that good cholesterol. Both kinds of exercise have that similar benefit, but aerobic training seems to have more of that impact. And the kind of intangibles here too, improve sleep, stress relief. I see more of that from the aerobic side anecdotally. But really the other piece of this too is that the beauty of pairing aerobic training and resistance training, if you have insulin resistance or diabetes, is that, again, the strength training gives your body more place to put sugar, whereas aerobic training of certain kinds actually allow you to store blood sugar without insulin. So you have this insulin-independent blood sugar clearance. So it's a really vital way to quickly improve blood sugar issues if you're having poorly healing wounds or side effects from medications, and you really want to get fast control over this because of the long-term effects of chronically high blood sugar. A 1-2 punch between aerobic and resistance training has much more effect than either one independently. All righty, nutrition. I won't keep repeating myself and saying this could be a 3-hour talk in of itself, but this one in particular is very open to debate with highly passionate people of very different mindsets. You'll have your carnivore diet people, you'll have your vegans and everything, and the right answer is we really don't know, but there are a lot of pretty simple heuristics here. Number one, again, most things in moderation is probably okay. I am of the school of thought that if you're doing something in the extremes, you're probably losing out on something else and maybe oversampling something that may have a little bit of a negative health effect when taking that level. I mean, the carnivore diet's a good example. You have a ton of meat, yeah, you're gonna have low carbohydrate diet. You're gonna be supporting muscle mass and bone density, but there is a direct link between saturated fat and LDL cholesterol levels, so there's the negatives there. In this case, if we had to pick one diet that we can just recommend blindly, it's the Mediterranean diet. We'll go into what that actually is in the next slide. But generally, it's more than just a diet. It's also kind of a community around that Mediterranean diet, the social aspect. And so that's one way it kind of ties in all the components here of this multi-pillar program for just general wellness. Other pieces here, quick takeaways, high protein. If you're have any sort of kidney disease, then steer as much away from the animal proteins like the pork and red meats of the world. But generally, it seems like, and of course, talk to your doctor about any of these things before making any changes. The current prevailing research seems to suggest that the old worries about a high protein diet damaging the kidneys does not seem to be a factor, especially if it's less of the red meat and pork derived protein sources. If it's whey protein or vegetable proteins, in those cases, there does not seem to be a negative impact and maybe a positive impact for kidney health. So that's another kind of paradigm shift here that was nice to hear about because it's a lot easier to make a recommendation than all the nuance. Fiber, another one, maximize the fiber in your diet. And that's my recommendation to all my patients is plan out your protein, plan out your fiber, whatever you got room for, then in moderation is probably okay. Don't want to think about the rest of it that hard. There are certain situations, of course, where it's not 100% true, but generally that's a pretty easy way of going about planning out your meals. The last piece, minimize processed food and sugar. So sugar is not the devil, but it is not your friend all the time, especially when it's not slowed down by high protein, high fiber components of the same foods. So, whereas an orange is good for you, orange juice, unfortunately, is mostly just sugar water and some vitamin C and things like that. So that was one of the bigger heartbreaks I had in medical school when I had to give up orange juice upon learning that. But yeah, juice is unfortunately not the best thing. And I would much, much, much rather my patients have diet sodas, diet iced tea, all that stuff over a sugar sweetened beverage, because as much as it's been vilified, artificial sweeteners like aspartame or sucralose do not have the obvious negative health effects that A, people think they do, or B, that sugar in excess does. So it's all harm reduction in that kind of perspective. So the Mediterranean diet here, basically it's going to be a lot of fruits and vegetables that give you your antioxidants, your fiber, your all the minerals you need. So you're getting a lot more minerals from legumes and beans and dark leafy vegetables. That's really important. Unless you're on Coumadin, warfarin, then you got to be a little more mindful of that kind of thing. The whole grains. So I'm not a you can never have pasta again kind of person. I'm a if you like pasta, try and make it a healthier version of that with either one of the high protein pastas or a whole grain pasta with a lot of fiber in there. So again, anything that you're having with a lot of fiber is going to slow down any of the absorption of the starchy part of the food. The Mediterranean diet is very healthy, very high in healthy fats. So olive oil, fats derived from nuts and seeds. Seed oils are the new boogeyman on the internet. I do not subscribe to the seed oils being, again, the devil. But given the choice, avocado oil is a great one that I use a lot in my cooking or on my salads and things like that. Olive oil is great too. In some cases, the flavor, of course, might not mix well with some other stuff. Just kind of an aside here, I often will have a protein shake, and if I need to add a little bit more calories to it, to have it be a meal, I just pour some avocado oil in there, because right there you have a lot of healthy fats, good calorie source there, and a lot more satiating than just a protein shake by itself. Back to the proteins here, fish, poultry, legumes. That's very, very important in the Mediterranean diet. Less of the red meats and those other sources. But the issue with only vegetable sources of protein is that they may not have the same amino acid profiles that animal-based proteins have. So if you hear about things like branched chain amino acids, that's going to be amino acids like your valine and leucine and lysine, all those. And the benefit there is they stimulate a protein in our muscles that is a signal to rebuild and everything. So if you're eating a lot of animal proteins, you may essentially need a higher amount of that protein to have the same effect as what you're going for on the animal side. They're also bound to a lot of fibers. So fibers help you prevent the absorption of all the sugar in certain foods, but they also will slow down the absorption of protein and things like that in the foods too. So it's another reason why vegetable proteins require a little bit higher of a rounding up in terms of the amount that you really need in a day. Okay, hormonal health. So when it comes to this general discussion, number one, men need estrogen too. Number two, women need testosterone too. There's no male and female hormone. There's kind of the ratio that matters. And we used to think that if you're male and having lower testosterone, bringing that up any higher inherently has a higher risk of cancer and prostate issues and excuse me, and liver issues. We're finding that's actually not really the case. Excuse me. Really, as long as you're going from low to normal on the male side, oftentimes it's actually mostly just health benefits. The benefits of that one are going to be supporting muscle mass and then indirectly bone density, feelings of vitality and energy and mood and sleep. All those things will improve if you're going from a low to a normal testosterone level. If you're going off the charts, like some people will do if they're not being well managed, that's when you get into those risks that we've known about for years. But we had a bunch of research come out in the past few years that gave us a lot of confidence that testosterone therapy is not a vanity exercise that's actually shortening your lifespan. It actually may have a lot of health benefits and longevity benefits. On the female side, this is an extremely hot button topic. It's gotten a little cooler over the past few years, but the gist of it was in the early 2000s, a big study was published. It's called the Women's Health Initiative. I'm sure a lot of people have heard of this one, and it scared everyone away from HRT for menopause therapy. Over the years, we've kind of walked back the findings, realizing that, oh, well, we oversampled, this population that has, been postmenopausal for more than 10 years, or, oh, we had this source of hormones, and maybe that has less of an impact. And so generally, it appears that HRT is safe for many women, most women, especially when you factor in the direct impacts of that drop off of hormones. So whether it be sleep quality, poor sleep, we'll get into that later, but it is going to have negative impacts across your health in terms of raising your hunger hormones. So you're going to eat more. It's going to raise your cortisol. So you're going to gain, gain fat and burn muscle. It's going to raise your blood pressure. It's going to raise your blood sugar. All those sorts of things. So if sleep is an impact here, and we're fixing that with progesterone therapy, the benefits are pretty obvious in that one domain alone. But then when it comes to estrogen replacement, well, that may be associated with reduced cardiac risks and reduced risk of cognitive decline. That one's a little bit murky right now. Bone density is inarguable, potentially a benefit for colorectal cancer risk. So these sorts of things, while not a blanket recommendation for everybody, is something that you want to be speaking with your physician about if you're within, kind of perimenopausal or early postmenopausal time period, if you're having symptoms, because there may be options for that, and it is not completely off the table as it was for so long. Any questions here? Okay. Moving on to stress management. So it's very easy to say, just relax, it's good for your health. But really, there are simple ways to improve stress, or ways to improve stress while doing other stuff. So exercise, of course, is my main stress relieving strategy. It's a good way for me to have a guilt-free turning off of the phone and just focusing on something for a little while, and really that one dedicated task instead of trying to multitask in your mind. That's where a lot of the stress in our day comes from. Being able to focus on one thing at a time is in and of itself often stress relieving, because you get in that flow state, or you're not constantly trying to overburden your brain by task switching and juggling tasks and all that kind of thing. When it comes to the indirect effects of stress, it's across the board. Really the elevated cortisol levels, so it's one of the stress hormones, has negative impacts on the heart, of course. But then when you factor in the impact on sleep of stress, everything's really impacted here when it comes to weight gain and cardiac issues and diabetes and cancer risk. Really when it comes down to it, poor sleep and shift work disorder is so impactful on our health that, it is, I think the WHO gave it a pretty strong connection to cancer risk because of the impact on our white blood cells and how they fight cancer in our bodies, kind of thing. So really, really important to focus on sleep here. In a lot of cases, if you're sleeping well or you improve your sleep, your ability to manage stress in general gets better. And then the dominoes effect, of course, and you have better sleep after that, and health continues to improve. So if there's one thing to prioritize first, I often start with sleep, actually, because that makes your response to exercise better, nutritionally better, and that is something I'll tie in at the end here. There are a lot of other ways to improve your stress levels without necessarily having to focus on exercise, or there's professional help, of course, that's really beneficial for many. But just moments of mindfulness, or just taking 10 minutes to kind of have a quiet place and know that you're not going to be bothered with distractions, that is meaningful in and of itself. So the ways to approach this are limitless. There are plenty of apps for it. There are, of course, professionals that can walk you through this kind of thing. But finding the one that works for you is the most important part here, because there's going to be something that works for all of us in this one.
So I do have a question for you on something you just talked about. Someone asked if you could speak a little more about the lack of sleep and white blood cell levels. Like, what was the correlation?
Yeah. So when it comes to poor sleep quality or lack of sleep, when it comes to sleep, there are different stages, of course, right? So the two main ones that we focus on are deep sleep and REM sleep, and they each have different benefits in the body. I'm going to be oversimplifying here, but it's a pretty good way of looking at things. So REM sleep, I always factor more on the emotional health, mental health, that area of sleep. And that's really because they believe that one of the reasons we dream is that's our time to work through stressful or traumatic events in a controlled setting without the same response to adrenaline and those sorts of things. So it lets you kind of walk through whether it be, a work interaction that sat wrong with you, or something more traumatic in that respect. By doing that in REM sleep and having kind of less response to adrenaline and noradrenaline, our bodies then get to process that better, and therefore we have better emotional health the next day. So blunting REM sleep, really bad for emotional health. That's when you get anxiety and worsening depression, those sorts of things. On the flip side is the deep sleep side. So deep sleep broadly is the kind of physical health, whole body health. A lot of important repair mechanisms happen during deep sleep. In the brain, that's when have you heard of the glymphatic system? It's kind of a new term floating around here. So the glymphatic system is the way that our brains kind of let down the blood-brain barrier, and our immune system can come in and kind of clean out all the gunk from the daytime. So when it comes to cognitive health, deep sleep's important there too. But with the rest of the repair mechanisms in the body, they found that our white blood cells and immune system in general depends on deep sleep and overall sleep for the health of those cells. And a big part of surveillance that the cells are doing is kind of floating on our bodies and looking at cells that look kind of funny, and they will kind of check on some proteins that our cells are expressing to see, is that foreign, is that normal cell, so bacteria, viral, or normal cell. And then if a normal cell, well, is it expressing proteins associated with cancer? So if your white blood cells are floating around and picking up those sorts of things, then they're going to attack those kind of questionable cells and clear out precancerous cells or early cancer, things like that. That's kind of how some of the newer medications like Keytruda can function in helping us fight cancer. Well, if you're not getting enough deep sleep, or sleep overall, then that part of the immune system is going to be dampened. And if you have that aspect dampened, well, then you're going to have less checks and balances on cells that might be kind of getting off track a little bit. So over time, then you just increase the risk that they're going to have enough time to divide and mutate and things like that. And that's where we think that increased cancer risk comes from. There are medications that affect deep sleep more than REM sleep more than deep sleep. But there are certain medications we use that actually can improve one or the other. This would be another one in the weeds here, but just as an example, one medication that I use more for sleep than pain is gabapentin. Gabapentin everyone uses because of nerve pain, yada yada yada. Its efficacy in nerve pain is not as cut and dry as people expected. However, it does actually increase the duration of deep sleep. So when someone is having insomnia, and I'm talking to them, trying to figure out kind of where it seems like their sleep is most impacted, are they an anxious person? Are they having worsening mood? Or are they, currently ill or chronically ill? And is that a priority here? I may choose something that's going to focus more on that deep sleep, so like gabapentin to support that, or I might pair it with something else that may have a more REM sleep benefit. But really, all sleep is important for the body, but there are different phases that have different impacts. And it seems like the white blood cells, the immune system, and everything is more dependent on the deep sleep side of things.
Great. All right. So there was another question, which what you just talked about answered a little bit, but someone was asking about how do you increase your REM sleep or deep sleep? And you just mentioned there could potentially medication.
Yes.
So we can use a fitness tracker to inform the amount of time we have in each stage, but how do you actually increase each? And that might be a whole nother talk, but any
Yes.
any kind of quick answers there?
Quick answers for that one. If you think about kind of when our brains are going to be each phase of sleep. So early in the night, we go through the sleep cycles and spend most of that end period in deep sleep, briefly in REM, and then start over again. As the night goes on, we spend shorter time in deep sleep and more time in REM sleep, which is why, this isn't the only reason why, but why we often have more dreams at the end of the night. It's because we're spending more time in REM at the end of the night versus early in the night. There's more to it than that, of course. You're going to wake up more likely at the end of the night anyway, because you already slept and all that stuff, so you'll remember them better. So making sure that you're not shortchanging sleep in one of those ends actually is impactful. So if you're chronically getting up very early, you might be blunting that REM sleep. So making sure that you give yourself an appropriate sleep opportunity, so enough time in bed to actually get roughly 8 hours or so. That's a pretty simple way to optimize your chances of really having both quality deep sleep and REM sleep. Deep sleep also is pretty dependent on temperature too, more so than REM. So in that case, you want to make sure that your ambient temperature in the room is cool enough to help your core temperature get down there. Um, in that case, you also can kind of trick the body into dropping that temperature faster. So that's one way they think melatonin helps. That's one reason they think that CBD may be beneficial for sleep, is that it may have a little bit of a core temperature dropping effect. But a big one is saunas or hot environments before bed. That's why I'm a big fan of bed socks. So I don't go to sleep barefoot, because what you want to do actually is make sure that your extremities are warm enough that your hands will have good blood supply. So if your feet are covered, then your body's going to say, "Oh, I don't need to constrict blood vessels. I can open them up a little bit, and you'll radiate heat off better, and it'll help you drop that core temperature a little faster." That can actually help sleep quality, and I would assume deep sleep in particular. For REM sleep, a lot of the benefit is going to come from, again, not setting your alarm too early, but also avoiding things that are going to affect REM sleep. Alcohol, cannabis, I mean, really eating too close to bedtime affects sleep quality in general. Um, Medications like antihistamines can affect REM sleep. Um, Understanding which medications may have a negative impact, and finding either, some things you just can't avoid taking, and that's understandable, but maybe the timing can be changed. Um, that Those are kind of more simple strategies too. But really, it's about the sleep hygiene side of things that can have the fastest and best impact on sleep. So making sure that you have enough time to sleep, and that if you're not able to fall asleep quickly, then you don't spend time lying there staring at the ceiling, because then your brain gets an association between bed and insomnia, not bed and sleep, and so it becomes a vicious cycle. Blue light before bed, bad for that, of course, too. So minimize screen time before bed in stressful situations, and I'm guilty of this just like everybody else is, because this is 2025. We have things to do, but finding ways to minimize those sorts of interruptions is important. Um, I could, again, do this for hours, but did that answer the question reasonably well?
I think that was good. So
Okay. We can go back to it again later at the end too, if we have time still. Alrighty. So now let's circle back. We're going to go through highlights of each of the slides from before, but now tie it together a little better to show that, again, by improving one, you improve the efficacy of another pillar here. So if you improve the sleep quality, then nutrition gets easier, and exercise recovery gets better, all that stuff. So now we'll kind of do it again and show how they interact a little bit better here. Number one thing when it comes to any benefit is going to be consistency. Doing it well for 1 or 2 days versus a little less well for the rest of the week. I would take the week of consistency more than a couple of days of great adherence to something. When it comes to exercise, that consistency is dependent on don't get hurt. So the number one rule here is don't get hurt, because then you can't be consistent with exercise. In this case, resistance training, again, has all these benefits here. How can we maximize those benefits, or how can we use those to maximize the benefits of something else that also has a similar effect here? So again, insulin sensitivity, number two there. Well, if you pair that with a little bit of aerobic training, then you're going to get that dual impact on helping the body dispose of blood sugar better. The maintenance of lean mass, again, that's going to help the nutritional impact on weight loss keep the weight off that way. Broadly, I always tell patients that exercise is a lot of the health benefits. Nutrition is a lot of the weight loss benefits. Of course, losing weight has health benefits. Of course, exercise will support weight loss, but if you had to pick one in each category, that's kind of where things lie. So the two of them together, of course, make those benefits work a lot more substantially. So in this case, that's where the cardiovascular benefits come in here. Blood flow, circulation, you get that from resistance training. But if you're someone who's got just the typical blood vessel issues that we get as we age, poor circulation to our feet and calves, getting cramps, well, progressive overload and slowly increasing the amount of time you can do something before it's intolerable, that's how you get the body to produce more blood vessels and increase blood flow and learn how to better regulate that constriction and dilation of blood vessels. I spent a lot of time working in inpatient rehab, and a big problem that we see there is after folks have gone through 2 or 3 weeks in the hospital, if they didn't already have issues with blood pressure up and down, it is one of our biggest problems when they first get to us, because then all of a sudden, the second they get out of bed, their body's not conditioned to be able to regulate blood pressure well, and they go from too high to too low, and we have to put them back in bed and not do therapies that day because we can't control blood pressure. So in this case, stressing the body out in a controlled setting helps it to learn how to self-regulate a lot better. In way more areas than just this, but this is kind of the top of mind example here. Back to the nutrition side of things again, protein, number one thing. If you had to pick one thing to start in terms of your planning, it's what protein are you having for that meal? Really broadly, the recommendations for the amount that we need keep going up and up. And I say aim for 1 gram per pound of ideal body weight a day. So generally about $1.25 for women, 150 for men a day. Divide that as evenly as possible. The most important times are going to be morning and as late in the day without affecting sleep as possible, because you're going to have that fasted period and you want to make sure that your muscles are getting enough stimulus throughout the day to maintain muscle mass. And protein is one of the main ways that stimulus. The second being a mechanical effect from exercise. Paired together, way more effective in building muscle. Fiber, again, helps with digestion, helps with bowel regularity, but also is going to help control blood sugar. So it's going to make your nutritional effects a lot more effective if you're also making sure that, it'll make the exercise much more effective if you're having enough fiber in your diet to help regulate the absorption of foods and the nutritional side of that whole equation there. LDL cholesterol, actually, a high fiber diet is associated with lowering your LDL cholesterol too. So if that's a factor, stay on your statins if you need them. However, adding some fiber to your diet may help increase the efficacy of the medications and the exercises that you're doing. Processed food reduction, that's not rocket science. In this case, avoid things that are overly processed. That's when they strip out a lot of the benefits and leave just the highly palatable side of things. And that's where we get into the trouble. Of course, I eat a lean cuisine meal every now and then or something like that because we're pressed for time. We got to find ways to do this quickly. But given the chance, if I'm having something processed, it might be a processed protein shake instead of some other kind of quick grab kind of meal. And number 4 here, avoid those sugar sweetened beverages. Again, juices unfortunately are not as good for us as we thought they were. Even the blended fruit smoothies that you get in the grocery store, like the Bullet House Farms and those kinds of things, delicious. 50 grams of sugar per bottle of those things. And our bodies can manage fructose to a certain extent, but generally it's got to be absorbed gradually. If you're slugging 50 grams of sugar in one sitting, it's going to be not gradually at all, and that's when you might get some of the negative effects there, contributing to fatty liver disease and things like that. Back to the male hormone optimization here. Again, by bringing up testosterone, you'll be more responsive to exercise. You'll be more interested in exercise. Mood is improved both directly and also for the improvement in libido and sleep quality and those sorts of things. Bone density is hugely important on both testosterone and estrogen. In this case, for men, a lot of the benefits of testosterone supplementation come in because of the conversion to estrogen. So we used to, if we were repleting someone's low testosterone in a male, we'd say, all right, let's give you testosterone and maybe we'll block the conversion to estrogen to just keep that testosterone nice and high and get rid of that woman hormone. Well, now we know that's ridiculous because in a lot of cases, the benefits of it are actually coming from that conversion to estrogen. And it's really only when you have too high of a spike because you're dosing it too infrequently that you get the negative effects that we think come from the estrogen, which might be, breast development in men and things like that. So both hormones are important for men and for women as well. So when you're thinking about estrogen and things like that, that's when the cardiovascular health comes in, the cognitive function, bone health and density maintenance and weight management, metabolic, insulin resistance happens perimenopausally just because of those changes in hormones and the impact on glucose management. So by pairing appropriate treatment of hormonal issues with nutrition, well, it makes nutrition more effective. Pairing this with exercise and strength training, well, it makes it a lot easier to build that bone density and muscle mass if this is an appropriate treatment for you. But again, it is still a hot button topic, and absolutely speak with your physician prior to, well, you can't really get this stuff without that, but it's a discussion to be had. Stress. So to recap, cortisol levels, bad for sleep quality, bad for weight gain, will wither away muscle mass. will affect your sleep patterns. And then you get into all the problems with bad sleep that we talked about. If you have a lot of stress, both directly, indirectly can lead to emotional eating and taking more calories, whether it be the poor sleep raising your hunger hormone levels, so you're going to eat more food for that reason, or there's the emotional component that drives us to eat a lot of times as an unhealthy coping mechanism. So managing stress will make the rest of all this stuff a lot easier for sure. And that's how they all kind of interact. The best way to implement any of these changes, I try and say, find the lowest hanging fruit, start there, do something, you know, I always counsel patients who say, I want to get exercising 5 days a week, and I say 3 days a week is perfect. Do that, because 5 days a week is a high bar to reach, and you're more likely to get hurt or get burned out or get discouraged because all of a sudden work came up and you can't make it to that 5th day of the week. And all of a sudden, well, what's the point? I can't even make it to the gym. You want to set realistic goals. You want to make sure that they're measurable. You want to make sure that you can achieve them. And then you want to have a time period of achieving those goals. So start low, start appropriate, find ways to integrate a couple of things here, and then you'll be much more likely to get the momentum going forward. And then you can make some of the bigger changes. The one caveat there, of course, is if you're trying to cut back on addictive substances like nicotine and alcohol, studies show that doing two at once actually might help make that easier. But in general, with lifestyle changes, build on progress. Don't aim super high right off the bat, but track it. You can't improve things if you're not measuring them. So track your progress in these things. Track your steps, and if you're getting 3,000 steps to start, that's fine. Aim for 3,500. Aim for 4,000. Slowly increase those sorts of things, and just see how you can do this more sustainably. Nutritionally, if you're struggling with weight or struggling with nutritional kind of guidance, start by keeping a food journal and seeing really where the calories are coming from, where in the daytime is this happening, and what are triggers for some of the slip ups or indiscretions. If you can figure that out, then it's a lot easier to address these sorts of things. And again, won't be a massive jarring impact on your life and your family life and your social life and all these things. I think that's about it here. Really, again, doing all together makes it a lot easier to achieve any of these things and sustain them. Consistency is key. You want to make sure that you're not getting hurt. You want to make sure that you're able to stay on track with these things. And if you do, it's a lot easier to stick with them, and you'll feel so much better, and you'll just be able to kind of give the next step up a big try here. What questions can I answer for everybody? And that's my email address. Feel free to email a question or really anything I can do to clear up some of these details or tell you about the practice or kind of whatever comes up. And that's the practice phone number. You can reach me there too.